Good morning, everybody. Progress, not perfection. Dr. Vuong here, best effing dad, with your quick COVID update. Today is Saturday, January 15th. It's going to be short. And I'm going to give you an update on my symptom status. But the numbers are bad. Yesterday's numbers, which represents Friday, is 924,000 cases in America in one day. So we are really getting close to that million case a day mark, and that's not a backlog from the weekend. So I think we're going to hit it next week. Now snowstorms coming, so some places are going to shut down for testing, so that might affect the numbers. But eventually we're there, and I'm going to talk to you about my thoughts on testing again, and try to get y'all to understand, because I'm getting some nasty comments about testing, and this is a new world that we live in. I like Dr. Campbell. I listen to Dr. Campbell, but I'm not sure Dr. Campbell's ever treated a patient, much less, had to intubate a patient or extubate a patient, as I have. And so, New York is starting to peak, maybe come down a little bit. New Jersey also. So all those areas that were hit first, they're looking at least plateauing and maybe coming down a little bit. But, it's still going to be another, week, 2 weeks for the numbers to come down. And the other areas that are lagging, for example, remember a couple weeks ago, I was making fun of Phoenix because Phoenix hadn't gotten into the game yet. Well, now Phoenix is in the game. It is 10,000 cases a day, but it's lagging by a week and a half. So we're going to have multiple areas that are still hot. So our caseloads are going to stay high. Dr. V, those are numbers. Omicron is mild, blah, 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 blah. Milder, it's not the cold. And, hospitalizations are going up. Yeah, but deaths, and I like deaths are going up too. We're over 1,900 deaths yesterday. And so we're going to pass 2,000 deaths a day here in America. And not to mention the global problem. And India, is on fire. And Europe is still on fire. And UK has been plateauing for weeks, and this is exactly the scenario I'm talking about, for the United States. We'll do the same thing. It's not going to be straight up and straight back down like in South Africa. We're going to have a long plateau, right? And that will take us all the way into February, and it'll be the end of February before we really pass this Omicron. So deaths are going up. Now, some people are sitting there going, yeah, Dr. Vuong, most of those deaths are from Delta. Yeah, maybe. You might be right, but we've been dealing with Delta since the summer and then the fall surge. And so, a lot of those deaths have already made their way. And you got to remember that, the deaths were not really increasing in the fall, very slowly, and now they're really increasing. So there's an extra boost to the Delta numbers, and that extra boost is Omicron. So some of those deaths are going to be Omicron, and as we progress through this, looking into March, most of those deaths will be Omicron. So, like I said the other day, Biden, bless his heart, that's a Southern saying, oh, bless his heart. He's doing the best he can, but man, by the time he gets out these tests, like free rapid test for 4 per household. Dude, we're gonna be past all this. And face masks for everybody. Dude, we're a little too late, man. So what I want to talk about is give you an update. I've been having this kind of hacky cough, a little bit of nasal congestion, a little mild headache. I gave up caffeine, so this is what doctors have to figure out. Okay, what is due to what? So was my headache due to giving up caffeine? This is tea, not coffee. Is it due to sinus pressure from the nasal congestion? Is my hacky cough from post-nasal drip, et cetera, et cetera? And I told y'all, I said, I'm not going to test myself. Why? Because I'm in Houston, and we're having 10,000 cases a day. You just have to assume you're positive. It's not going to change anything, okay? So I got some, just some horrible comments and haters on this, and let me explain to you. I'm talking about you guys didn't listen to me back in the summer when I said, listen, you need to get vaccinated because we're going to live in a post-vaccination world. And you're seeing that tennis player can't play in the Australian Open because he's not vaccinated. Dude, it's the same thing. Nike announced that they're letting go of unvaccinated employees. Hospital systems are letting go of doctors and nurses, and they're a small minority. There's small minority. And the same thing with the military. I mean, like, oh, 200 or 300, 400, and, Navy, service people have been let go. Like, dude, that's such a small percentage of the entire armed forces, So same thing with healthcare workers. You're just going to have a few dodo heads. You'll never have 100% compliance. That old saying, the only thing that's guaranteed is 100% is death and taxes. I mean, other than that, you're always going to have a fringe number. So I told you in the summer you need to get vaccinated because that's the world we're going to be living in. And I'm telling you now, when you are in a hot zone, you just need to assume you're positive, because testing, that is not the time to test. So you assume you're positive, and then you isolate, which is what I did. We stayed home. We didn't really go out, didn't go to restaurants. We ordered food. I cooked more at home. When I went out, which you're going to have to go out, guys. The day of like, hey, I'm positive for COVID, I'm just going to lock up in my bedroom. Those days are gone. That was like the early days when we didn't know what was happening. We do know a little bit more. Omicron is a little bit milder. There will be another variant that's even milder than Omicron, because Omicron is too virulent, guys. It's making too many people too sick. Supply chain disruption, staffing shortages, from the farmers to the truckers to the people who stock the shelves. That's why you're seeing empty grocery store shelves, okay? So in the New World Order, now I sound like a conspiracy guy. In the New World Order, when you have symptoms, you're going to put on a good face mask. So, we're going to get rid of these cloth face masks. If anyone's still wearing those gaiters that you're pulling up over your face, those have been useless for a year. That's like, hello, 2020 called and they want their gaiter mask back. Like, it doesn't work, And now, like, fabric masks aren't as good. You really need at least a KN95, okay? And honestly, an N95 mask should be, when I was fitted for one in med school, no goatee. I had to shave, and they put you in this chamber and they spray what was it? I think it was cinnamon maybe, and you had to see if you could smell it or taste it. It had to be a tight fit, So just ordering one off Amazon, it's better than nothing. I mean, it's good. It's the best we got, but it's not a true N95 is my point. So back to the whole symptomatology, the future is going to be when you start coughing, sneezing. If you live in a hot spot, you just have to isolate as much as possible. And then when I did go out, I needed something from Lowe's, right, to unclog my garbage disposal. I needed that little key. And I put on my KN95 mask. I went right into where it was. I got it. I self-checked out, and I came home. I mean, that's the life you have to live in. Now, Dr. Vuong, what about, your family members? So Erica is fully vaccinated and boosted, and our 5-year-old is double-dosed vaccinated, right? Don't have symptoms. Now, if it makes you feel better, you can test them, but if you are asymptomatic, the chances of a rapid antigen test turning positive is very low. So just because it's negative doesn't mean they're not carriers. I totally get that, but kids got to go to school. You just got to put a mask on her. Erica goes to work. She's a waitress. She wears a KN95 mask at work. And that's the new world order. When you are in a hot spot, that's how we get past this and keep living our lives. So we're going to do a road trip because Erica had a family member that died, a close family member that died. I said, okay, babe, and I don't like traveling. It's, really bad right now, but if you feel strongly, we're going to go. So, I tested myself last night with a Binax rapid antigen test, and guess what? It's negative. So, you say, I've had this cough for about a week. Dr. Vuong, you waited too late? Maybe, right? It doesn't change my thesis. Maybe if I had tested 2 days ago, I might be positive, but right now I'm negative. And by CDC guidelines, I'm past 5 days, 7 days, 10 days. with a negative antigen, I can go out in the free world if I want to. Well, that doesn't mean like you just like, hey, let's go to concerts, I'm negative. No, see, that's what idiots do. Even though I have the negative rapid test, I'm still going to wear my face mask. I'm still not going to go to concerts. I'm not going to go to choirs. I'm not going to go to sporting events. I'm going to keep doing the same thing I've been doing, which is my point. The test does not change the treatment. Now, we're going to get to Albuquerque on Sunday. We're going to be around her grandparents and elderly people for this funeral. So what am I going to do? I'm going to bring with me, because I have a set of rapid tests, and I'm going to test myself before we start seeing people, because I love her grandparents and don't want them to come down with it, even though they're both vaccinated, and that's the key. Everybody in this scenario is vaccinated, but I'm still going to test myself just for that extra assurance. And if it's negative, I'm still going to fucking wear my mask. It does not change the protocol, is my point. Does this make sense? This is how we need to do it. No, Dr. Vuong, like you test, you're negative, you're good. That is so pre-Omicron. Stop coming at me with these pre-Omicron recommendations. Dude, I'm telling you, this is the smart way. Listen, I'm a surgeon. Surgeons have to think logically, otherwise the patient dies. We have to work through this scenario, man. And so God bless the CDC, but they are so far, they're behind. And listen, and the other thing I'll say about testing is this. When these rapid tests came out, they were maybe 85% accurate on a good day, 85% accurate against the wild type. And then when Delta came, those numbers dropped to about 80% accurate for Delta. Now, I'm telling you, with Omicron, I would not be surprised if we saw reports of 65, 70% accuracy with Omicron. And if that's the predominant strain, and you have a test that's only 65, 70% accurate for Omicron, it's a useless test. I'm telling you. So you can't rely on it. It's an indicator. It might give you a hint, yes, no, but it's not a decision maker. It's not like a slam dunk thing. The slam dunk thing is you have a cough, you have an upper respiratory illness, and we know Omicron is more upper respiratory as opposed to pneumonia, lower respiratory. So you just got to assume you're positive if you're in a hot state, and the whole United States is hot. So everybody with symptoms, just assume you're positive and do what I outlined here. And we will get through this. And obviously, keep in touch with your doctor. If your symptoms get worse, go to the emergency room. Be prepared to get admitted or do whatever they recommend. Don't go to an ER, sit there for 5 hours, 6 hours, and they say, hey, we need to admit you. And you're like, no, I'm more comfortable at home. I'll go home. I'll tough this out. And they're like, dude, why did you go to the ER? Because you think you're smarter than the doctors and than these healthcare providers who've been dealing with COVID for 2 years now and treating patients and staying up to date? It's just crazy. I don't care what effing website you read. You're not going to be that trained as a professional. Okay. So I think I got everything. The protocol, the masks, the efficacy of rapid tests is going to be much lower with Omicron. And we're going to get through this, y'all. But this is the smart way to do it. And I mean, imagine, why would you stand outside in a line with a bunch of possibly infected people? I mean, that's like going to where the cannibals are, let's say you're on an island and there are cannibals on the island and you see like this party going on the beach and you go, hey, there's some people having a party on the beach. Let's go there. Like, why would, they're cannibals. Oh my God. Like, why would you go to where all the disease is? Don't do that. Stay home. You're much better off. Especially if these labs are overwhelmed and you're having to wait, 4 or 5 days, 7 days for a PCR result. It's not worth it. Just assume you're positive. Keep in touch with your doctor. Go to the emergency room or the hospital if your symptoms progress. I'm getting better. That's what it means to be boosted. A mild disease, right? All right. Love y'all very much. I hope this has been helpful. I guess it wasn't that short. See y'all next time. Stay safe, everybody. It's going to be a rough couple of weeks.